Helicobacter pylori, or H. pylori, is a corkscrew-shaped bacterium that calls the human stomach its home, often without invitation. It's a sneaky little organism, capable of causing significant damage over time. Many people are infected with H. pylori without even knowing it, but for others, it can lead to gastritis, painful peptic ulcers, and in more serious cases, even stomach cancer. Understanding how this bacterium spreads is crucial for preventing infection and protecting your health. The most common routes of transmission for H. pylori are through contaminated food and water. Imagine drinking water from a source that hasn't been properly treated, or eating food handled by someone who hasn't washed their hands thoroughly. These are prime opportunities for the bacteria to enter your system. But what about more intimate forms of contact, like kissing? While less common, the possibility of transmission through saliva is a valid concern. H. pylori has been detected in saliva, raising questions about the risks associated with close contact. What makes H. pylori so resilient? It's all about its ability to thrive in the incredibly acidic environment of the stomach. Most bacteria would be quickly destroyed by stomach acid, but H. pylori has a clever trick up its sleeve. It produces an enzyme called urease, which neutralizes the acid surrounding it, creating a protective bubble. This allows the bacteria to survive and multiply, leading to a persistent and potentially damaging infection. This remarkable adaptation is what makes H. pylori such a formidable and long-lasting foe in the human digestive system. The risk of contracting Helicobacter pylori, the bacterium responsible for stomach ulcers and related issues, through kissing is a topic of interest, though the likelihood remains relatively low compared to more common transmission routes like contaminated food and water. Scientific studies have indeed detected H. pylori in saliva, offering a potential pathway for oral transmission. However, the concentration of the bacteria found in saliva is often not high enough to readily cause infection in individuals with healthy immune systems. Several factors can influence the potential for transmission through kissing. Oral hygiene practices play a significant role. Individuals with poor oral health might harbor higher concentrations of H. pylori in their saliva. Furthermore, the strength of an individual's immune system is crucial in determining their susceptibility to infection. A robust immune system can effectively combat the bacteria, preventing it from colonizing the stomach. Finally, the frequency and intensity of kissing can also contribute to the risk, with more intimate and frequent contact potentially increasing the chances of transmission. While the evidence suggests that kissing is not a primary mode of H. pylori transmission, it's important to consider the nuances and potential risk factors involved. Individuals with concerns about H. pylori transmission through kissing should prioritize good oral hygiene and consult with healthcare professionals to assess their individual risk profile and implement appropriate preventative measures. Understanding these factors can help individuals make informed decisions about their health and well-being. Protecting yourself and others from H. pylori starts with simple yet effective preventative measures. One of the most important is diligent hand washing, especially before eating and after using the restroom. This helps to minimize the risk of ingesting the bacteria that might be present on your hands. Equally critical is ensuring that the food you consume and the water you drink are from safe and clean sources. Proper food handling and preparation are key, as is ensuring that water is purified or boiled if you're unsure of its source. These basic hygiene practices form the foundation of H. pylori prevention. Now, let's say you've been diagnosed with H. pylori. What's next? The standard treatment typically involves a combination therapy. This usually includes a course of antibiotics to eradicate the bacteria and acid-reducing medications, such as proton pump inhibitors, to help heal the stomach lining and reduce discomfort. It's absolutely essential to follow your doctor's instructions precisely and complete the entire course of medication, even if you start feeling better. Prematurely stopping treatment can lead to antibiotic resistance and the infection recurring. Finally, addressing concerns about transmission through kissing. While the risk is relatively low, maintaining good oral hygiene can further reduce any potential risk. This includes regular brushing, flossing, and using mouthwash. If you have any specific concerns or symptoms related to H. pylori, it's always best to consult with a gastroenterologist. They can provide an accurate diagnosis, recommend the most appropriate treatment plan, and address any individual concerns you may have, ensuring you receive the best possible care.